In this video, I will go over the infectious agents that can cause typical or atypical pneumonia. So generally, typical pneumonia presents with lobar consolidation. So if this is one of the lungs, you will see the consolidation in one of the lobes. Versus atypical pneumonia, which presents with patchy or interstitial infiltrate. So there wouldn't be like lobar consolidation in atypical pneumonia. Common causes of typical pneumonia include Streptococcus pneumonia, which accounts for 95% of the cases of the typical pneumonia. Klebsiella pneumonia, which is commonly seen in alcoholics, as well as IV drug users, and finally Staphylococcus aureus, which is seen in hospital-acquired pneumonia. As for atypical pneumonia, viruses like influenza can cause atypical pneumonia, as well as Coxiella burnetii, Mycoplasma pneumonia, Legionella, as well as Chlamydia psittaci. So next, I would like to go over every one of these organisms and explain them in detail. So for typical pneumonia, Streptococcus pneumonia is the most common cause of pneumonia, and these patients usually present with fever, chills, pleuritic, chest pain, and productive cough. And then later on in the course of the disease, they would develop tachypnea. Similar symptoms are seen with Klebsiella, except that due to the necrosis of the respiratory tract, these patients will present with blood-tinged sputum, which is referred to as currant jelly sputum. And then finally, Staphylococcus aureus is usually seen in hospital-acquired pneumonia. You should also be familiar with the secondary pneumonia. So there are cases where the patients will report that they had fever and productive cough for a few days, then their symptoms got better after a few days, and then again they got worse. So that's the reason they came to the clinic for the evaluation. So then they got worse again. So this is an example of secondary pneumonia. So in the first place, the fever and productive cough, the patient had influenza. And then in the next few days, the patient started to feel better because the body was getting rid of the influenza. But at the same time, influenza virus will destroy the epithelia of the trachea and the bronchi and causes loss of cilia. And that is very important, loss of cilia. And due to the loss of cilia, these patients will be now prone to pneumonia. And then later on, they develop pneumonia, and thus their symptoms will be worse. And the most common causes of secondary pneumonia are Streptococcus pneumonia and Staphylococcus aureus. So Streptococcus pneumonia accounts for about 50% of the cases, while Staphylococcus aureus accounts for the 20% of the cases of secondary pneumonia. One last point that I would like to mention here about these typical pneumonia agents is that Klebsiella is a urease positive organism. So it's a urease positive organism that is in the normal flora of the GI tract, and thus is commonly associated with aspiration in alcoholics, as well as the IV drug users. Next, I would like to go over different forms of atypical pneumonia, starting with Mycoplasma pneumonia. So these patients, they usually do not present the symptoms of pneumonia. They're usually asymptomatic. But then if you obtain an X-ray, you will see that there is atypical pneumonia. So the fact that their X-ray of these patients is worse than their general symptoms, this is usually referred to as walking pneumonia. There are also extrapulmonary symptoms that are associated with mycoplasma, and these include the erythema multiforme, which presents with target-shaped lesions, it also presents with the hemolysis, with IgM agglutination. So what happens is that the body will make IgM antibodies against the mycoplasma, but then these IgM antibodies will interact with the red blood cells and cause hemolysis. So there is a molecular mimicry in this example which causes hemolysis in these patients. And finally, it presents with bullous meningitis, where there would be blisters on the tympanic membrane. And the kind of memory aid that you can use to remember these extrapulmonary manifestations is that mycoplasma causes erythema multiforme associated with IgM agglutination and causes bullous meningitis. The next two infectious agents are Chlamydia psittaci as well as Coxiella burnetii. So the first one is associated with birds. So patients that are in contact with birds can develop atypical pneumonia from Chlamydia psittaci, and then Chlamydia burnetii is associated with animals in general. And these patients usually present with the Q fever, which has flu-like symptoms along with rapid onset of fever and profuse perspirations. Another common cause of atypical pneumonia is the Legionella, which can present in two forms of disease. The first one is the Legionnaire's pneumonia, and the second one is Pontiac fever, where the patient will develop fever and muscle aches. And the pneumonia that is associated with Legionella has certain features such as confusion, GI symptoms such as diarrhea, high fever of more than 39 degrees C, presence of numerous neutrophils on the Gram stain of the sputum secretions. So the fact that the Legionella is an intracellular organism, you can't find it on the Gram stain, and you will have to use silver stain for that. So when you obtain a Gram stain of the respiratory secretions, you will see numerous neutrophils without any organisms. And then finally, due to the damage to the juxtaglomerular apparatus, there would be decreased renin secretion, and thus there would be decreased aldosterone, as a result of which these patients will present with hyponatremia. So on the exam, if you see any of these features, it should give you clues to the diagnosis of infection with the Legionella. And the memory aid that you can use to memorize the other features of Legionella is shown in this image. So here, the Legionnaire has a silver helmet. So silver stain is used to stain Legionella. At the same time, the other way of diagnosis is by checking the urine antigen or by growing the Legionella on the charcoal media. And then finally, the other feature of Legionella is the Pontiac fever that can develop in these patients. So again, just imagine this photo and then you will know that the silver stain is used for the staining of the Legionella. You can detect it by the urine antigen or you can grow it on the charcoal media. And then finally, one other feature of Legionella is the Pontiac fever. And that concludes our discussion.